Hi, my name is Vincent Law, and I'm here at ASCO 2024. I'm here presenting one of our projects at Dr. Forsyth's lab at Moffitt Cancer Center. So the research study here is the efficacy of intrathecal delivery of peptide pulse type 1 conventional dendritic cell vaccine for the treatment of breast cancer-associated leptomeningeal disease in our preclinical models. So a little bit of background, breast cancer LMD is a very devastating disease. The overall survival and prognosis is generally very poor. For example, HER2 patients' overall survival is between about 4 to 6 months, and our triple negative patients is about 3 months. So there is a major unmet need for effective treatment for our patients. So that's when our project, in collaboration with a breast oncology lab, Dr. Brian Czernecki's lab, we decided to use the dendritic cell vaccine platform where they use it to treat breast cancer. And we thought that could we use that platform to treat our LMD patient, LMD that were derived from breast cancer. So one of the major challenges of treating LMD is that the inaccessibility to the actual space because of the blood and brain barrier. So one way to get around that is to use intrathecal method, which is directly injecting the agents into the cerebrospinal fluid, so directly targeting the disease. But at the preclinical model, we don't actually have that, although at the clinic, the patients receive their treatment through Ommaya reservoir. But at the lab, we don't have that kind of model. So our lab had designed a preclinical model where it's called the marine Ommaya, which is a mouse version of the Ommaya reservoir. This little port here allows us to inject a novel therapy directly into the ventricle and the CSF of mice and to check on efficacy. And then for our DC model here, from Brian Czernecki's lab, they have developed this method of isolating these monocyte precursor cells and process them into matured dendritic cells, and we pulse them with a peptide. So combining these two technology, we decided to test whether if the DCs have efficacy against breast cancer LMD. So what we found was that we have two models. We have a tubal marine model, which is a HER2 positive model, and a 4T1 LMD, which is a triple negative breast cancer model. And what we found that the mice that received the intrathecal dendritic cell vaccine, we found a significant prolonged survival. And not only the tumor had regressed, but we saw the diseased mice actually have regained their normal body weights and function. Subsequently, when we examined their CSF, the mice CSF, what we found that after injections of the dendritic cells, we saw an increase of interferon gamma and other pro-inflammatory cytokines. And among sampling their cellular environment in the CSF, we found a change from a more innate immune profile to a more adaptive immune profile. Specifically, there are some T cell differences as well as a high infiltration of B cells. What is really interesting is that what we found, the cured animals from our study, when we re-inoculate them with a LMD, we found mice that were cured of disease by the dendritic cell vaccine were also resistant to cancer re-inoculation. This suggests that we can use the dendritic cell vaccine as a way to train the immune response of mice targeting the LMD. So with this work, we have got FDA approval for phase 1 clinical study. And phase 1 study, this is some of our very early data of a representative triple negative breast cancer patient and a HER2 positive breast cancer patient, both with LMD. What we found that each doses of intrathecal dose of our dendritic cell vaccine, we saw an influx of pro-inflammatory cytokine response, including interferon gamma, as well as TNF alpha. And we also noted that there is no influx of IL-4, which suggests our dendritic cell vaccine is a Th1 CD4 directed response. So our future work here is we're continuing on with our phase 1 study, but we also want to map the cellular mechanism within the CSF microenvironment of how our DC vaccine works. Our funding is supported by the DoD and as well as collaborate with the Roswell Park Comprehensive Cancer Center.